So, yes, thank you, Rachel, so much for this opportunity. Thank you for hosting the webinar series. I just think it's super important um, to bring this to the rural space. And a little bit about TRS is we'll get into it more, but we are dedicated to the rural clients, if you will. I would say 95% of our MSP clients are rural critical access hospitals. So we really understand, what you guys are facing and how to bring just kind of some light communication tips to bring your team in together to help with that retention. So before we dive in to the program, I'm going to go over a little bit just about our company. We were nurse founded in 1996. So just a nurse that wanted to make a difference in the industry. We started here in Northwest Arkansas, staffing per diem in Tulsa. And today it still remains family led by the founder's daughter. And we understand the challenges that organizations are facing. So we've expanded our services to provide more comprehensive solutions. And our offerings include a travel nurse staffing service that's ranked in the top 25 in the US, MSP provider to help our partners control that contingent labor cost. And again, that we specialize here in rural healthcare. And then we have our international direct hire program that is hospital sponsored. So, a great program for direct hire. And now we have consultative services, which is training that is aimed to help our clients boost their retention within their core staff as well. And our commitment to this is to help to address the ongoing staffing shortages from multiple angles to ensure that we create top quality patient care, not just for your family, but potentially for ours. So, our mission, just for the consultative service line, is to help hospitals achieve something bigger by fostering connection, empowering collaboration, and unlocking potential for extraordinary results. We provide accessible, low cost education to support their purpose of saving lives and enhancing patient care. And so, a little bit about me, just as your trainer here today. I have a bachelor's degree in organizational management, an MBA in leadership and ethics, and I have extensive experience in healthcare staffing and have been able to work with several hospitals to provide them some strategies around workplace culture and retention. And then outside of work, I like hiking through our shared mountain range. I'm here in Bentonville, Arkansas, so we have the Ozark Mountains here as well. So I love getting out with my dogs, and I'm also a foodie. So all the new restaurants in Bentonville has been such an enjoyment for me as well. So 30 years ago, when we got started in staffing, we heard one common complaint, and that was a lack of communication. And that's still ringing true today. And while many healthcare professionals feel unheard, which leads to frustration and disengagement, and ultimately burnout. So while we know we've mastered quite a bit of the technical skills, communication still is remaining a major gap. And when it's ineffective, it's going to impact teamwork, patient outcomes, and retention. So today we're going to explore some solutions to bridge this gap. So organizations thrive when people are connected. And one of the most effective tools we use to enhance your workplace communication is the Everything Disc tool. This powerful tool provides a shared language that fosters warmth, understanding, and collaboration within organizations. And this program is powered by Wiley Publishing, which is a 200-year-old publishing company. So it has the most sophisticated and dynamic approach to support our busy hospital professionals. So you can see here that DISC identifies four primary communication styles. The first one being D for the dominant style. And these type of people are very focused on results, they're action oriented, and they thrive on a challenge. The I style that stands for influence is enthusiastic and collaborative and really driven by relationships. And then we have our S style, which is supportive, dependable. They value stability and really love, bringing the harmony to a team. And then the last one, the C style, the conscientiousness, is supportive, dependable, but analytical, and they very much focus on accuracy. So we typically see these type of people in accounting or IT, things like that. And so, by understanding these styles, individuals and teams can gain insights to their own behavior and how to most effectively work with others. And the global trust and impact that this program has is significant. In total, DISC has impacted 10 million learners in 150,000 organizations, and it's available in 22 languages across 72 countries. The science behind the program provides a trustworthy assessment with strong psychometric properties and prioritizes quality by using not only computer adaptive testing, but global norming and real world testing. The Everything Disc program, again, is fueled by over 40 years backed research under the umbrella of Wiley Publishing. So, with that being said, I'm just going to play a quick video made by Wiley to dive a little bit further into an explanation for DISC. So, Rachel, please make sure the volume works on this, if or let me know if it doesn't.
It's your job to create a culture where things like this, or even this are possible. But what happens when you feel like you can't catch a break and drama keeps coming to your door? Or what happens when you're at your wits' end trying to figure out the best way to develop your people? Eventually, you'll say what we've all said before. So, how do you turn this into this? First, you'll talk about it with people you trust and respect. But that doesn't solve the problem. So you'll search keywords and ask for help from your professional network. And if we fast forward a few weeks, you'll likely discover Everything Disc and fall in love. Everything Disc introduces people to this very simple but very powerful people map. Everyone quickly finds out where they land, discovering each other's styles and preferences. It's about using this new knowledge to better manage a person or earn their business or work through an argument with them. Basically, it helps everyone communicate, leading to better relationships and teamwork. You work with your Everything Disc authorized partner and find the perfect solution to fit your needs and budget. Let's back up for a second and explain how you got here. First, you found that a lot of the learning solutions out there are flavor of the month training programs, which got people excited but didn't deliver lasting behavioral change, not to mention results. You needed a solution like Everything Disc that helps people understand themselves and what they need to do to work better with the people around them. But when you started looking at other personal assessment tools, you found that some assessments are too complex and hard to translate into something meaningful to the everyday situations your employees face. And other assessments are too simplistic, leaving you wondering what you're paying for and how it's supposed to help your team. Everything Disc is simple without being simplistic. The model is easy to remember and provides actionable ideas for working with others. Every employee walks around knowing what they need and how to work best with their peers. We have a passionate and dedicated team building and rebuilding, testing and retesting our products to ensure effectiveness, engagement, and satisfaction. So, whether you're looking for team training, one on one coaching, or large group seminars, your Everything Disc authorized partner can work with you to find a solution that meets your needs. So, what are you waiting for? How can Everything Disc improve your workplace today?
So, we use this base knowledge of the four communication styles in the application suite you see here. These are buildable trainings that can be implemented throughout different groups in the hospital, and some actually apply to each team member. This ensures that the consistent language throughout each training over time will open the doors to better communication. And another big reason we love this tool is that it's supported online. So, gone are the days of digging through an 80-page paper file from one training you did to each time you need some guidance on coaching a team member. With the Catalyst platform, the website, within just a few quick minutes, you can refresh your knowledge of any teammate and get fast suggestions on how to best communicate with them. We know that time is not what our hospital leaders have, so this quick solution is perfect for this type of environment. The Catalyst platform acts as a personalized, on demand home base for learners to call on throughout their entire DIS journey. And one of the coolest features is the ability to compare your DIS style with your colleagues and even create group maps. These tools give teams like fresh perspectives on dynamics and relationships and how they work together. It's all about taking what you learn in a training and using it right away with your coworkers, making a lasting change that really sticks. Another program that we offer is the Five Behaviors of a Team, which is based on the best selling book by Patrick Lencioni, The Five Dysfunctions of a Team. And this program is also powered by DISC, and it provides a wonderful experience either for individuals or intact team trainings that really dive in specifically how they work in a team. So, starting with the five behaviors assessment, they will take that test and then quickly go ahead and get fast suggestions on how to be exactly a better teammate within that team that they're currently on. The program helps build trust, engage in healthy conflict, and commit to shared goals, hold one another accountable, and ultimately achieve better results. To build a high performing team, we have to focus on four critical behaviors that drive success. Number one is going to be trust, and trust is the bedrock of any effective team. And when team members feel safe to be vulnerable with one another, they're more likely to share ideas, take risks, and ask for help. Conflict is not about personal attacks. It's about engaging in healthy, productive debates that can lead to better ideas and solutions. Teams that are comfortable embracing in conflict can challenge each other's thinking, discuss differing opinions, and make a stronger decision. Avoiding conflict is going to lead to unspoken frustrations and missed opportunities for growth. After debate, commitment is key. Team members need to align on decisions and collectively commit to the team's goals, even if they had differing views in the beginning. A committed team is focused, driven, and clear on priorities. Without commitment, teams become fragmented, leading to confusion, missed deadlines, frustration, which leads to turnover. And then we have a accountability. So teams need to be held accountable for their actions and responsibilities. And again, this isn't about blame, but ensuring each team member is contributing to the collective goal. The accountability section drives personal accountability as well and ensures that the teams stay on track, delivering results and achieving its objectives. And when trust, healthy conflict, commitment, and accountability are in place, teams can achieve extraordinary results. By integrating the five behaviors of a team framework in your daily interactions, you can create an environment where teams not only meet goals, but exceed them. And workplace culture, we know, is the key driver of engagement, retention, and overall job satisfaction. And when employees feel a sense of belonging and support and purpose, they're more likely to stay and contribute positively to the organization. And as you can see here, Wiley conducted a survey of over 2,000 professionals to understand truly the impact of workplace culture on employee retention. So, what they found is that while most employees across generations prioritize workplace culture over other benefits, the younger employees, specifically 18 to 24-year-olds, tended to prioritize time flexibility. This insight is important because it highlights a shift in the different generations. And while older employees are seeking stability and strong culture, younger employees are also placing a premium on their autonomy, work life balance, and ability to work on their own terms. And so, if we can have organizations recognize these shifting priorities and adapt your policy accordingly, you're going to be more successful in attracting and retaining top talent. And by fostering a culture that values both flexibility and connection, you can create an environment where employees feel empowered. And these qualities is what we like to call the emotional paycheck. So, not only has culture been found to be the most important non financial benefit that your organization can offer, but a staggering 77% of employees said that a positive culture is crucial to their decision to staying with an organization. And so we know that while salary and benefits matter, the everyday work environment has a greater impact on retention. And employees want to work in a space where they feel valued, respected, and engaged. And so when your leadership invests in building an inclusive and supportive environment, they're going to create a workforce that's not only productive, but it's committed to your organization's long term success, which is what we're focused on here today. And so training and development plays a role in this by sustaining your healthy culture and offering these consistent learning opportunities. Hospitals are going to reinforce these positive behaviors and equip employees with the skills they need to communicate effectively. So let's take a moment, if you'll help me, Rachel. I wanted to have somebody throw it in the chat if any of these statistics and this data surprised you, and if so, why? And if not, why not? I'm just curious to get your guys' perspective if anybody has any comment. We'll take like 30 seconds here. Yeah, so that's great. The generational differences I think is important. I think that we have to stop blanketing what we do for our organization and our people. And we have to really start diving in and treating folks as individuals and not just blanket policies to really, really dig into that retention factor. So thank you for your participation there. Okay, so whether you have a new manager that needs empowered to lead, a team that always seems to be in conflict, or you need to create a culture around emotional intelligence to reduce your turnover, we've got a training for you. So, coming back to the idea that we offer a suite of trainings, we want to highlight the importance of consistent small actions that build trust and collaboration over time. We encourage you to build upon your success by continuing the journey through trainings to truly build that muscle around these skills. Our process is typically we like to take a meeting with you to start off with your goals in mind. Sometimes we'll recommend one training over another if you have a hotspot in the organization. And then over time, we can implement other trainings to ensure this communication becomes a part of the culture. We also encourage our clients to commit to fostering a space of safety and openness. We must reinforce when leaders prioritize understanding, teams will thrive. And we have to remember that we have all lived with our own communication style our entire lives. And so this is going to take some time, some practicing and understanding to really adapt the way we all communicate. So, authentic communication is the foundation for a healthy workplace. When employees can express themselves openly and honestly without fear of judgment or misinterpretation, they're going to feel valued and engaged. However, one of the biggest barriers to authentic communication is misunderstandings. Often we assume others perceive and process information the same way we do, but that is rarely the case. And this is where everything disc is a game changer. This provides a framework for understanding different communication styles, helping individuals recognize why they communicate the way they do and how their style may be perceived by others. And another key aspect of authentic communication is active listening. That is a very hard trait that we all have to work on, I'm sure. But everything just encourages us as individuals to not only understand our tendency, but truly listen and appreciate other perspectives. And then when employees take the time to understand their colleagues and how they communicate, that mutual respect and psychological safety is going to come to the forefront, making it easier for everyone to share ideas, voice concerns, and collaborate effectively. And so, for a quick example for you guys, someone with the D style may prioritize efficiency and results and communicates in a direct, no nonsense way. Meanwhile, you've got an I style under that person who values enthusiasm and connection and prefers open ended, high energy discussions. And so, without understanding these differences, these two styles will clash, and the D feels like the I might be wasting time with too much conversation, and the I might feel like the D is too blunt or dismissive. However, when both individuals are aware of their differences, they can adjust and find some common ground here. So you can see how DISC helps reduce workplace misunderstandings by equipping employees with these tools of understanding. And it's just going to result in fewer conflicts, more productive conversations, and ultimately stronger professional relationships, which is going to help you guys with your retention and training. So I have one more short video of one of these programs being used in an actual hospital setting, and I'll play that now for you guys.
Developing Mount Pleasant is a life plan community. We have independent living, we have assisted living, nursing, we have a home health agency, adult daycares, hospice agencies.
We have 3,200 team members who work hard 24/7 providing this care throughout the state.
Our journey began with a team that was struggling. All of us were stellar individuals, but as a team, we couldn't get it together.
The five behaviors of a cohesive team was a calm in a storm that we perhaps didn't know we were in at the time.
Everyone really cared so deeply for their jobs and one another, but the communication was just off.
We're all nurses. Our goal in life is to help fix everyone. And within this team, we couldn't do that.
We heard that some people were so frustrated that they were considering looking for another job, and some were even actively looking for another job.
We went through several meetings close together. We called them retreat days. Applying that time and leading with intent, having the intent to spend time on each lesson and not just fluff through it, to really delve in and dig deep.
Every business outcome becomes better when you take the time to slow down and prioritize the things that matter the most. It is the most important thing that we do together is become cohesive as a team so we can deliver what we're all here and obligated to do.
Give us a language. Are we struggling with trust here? Because we're not being totally forthcoming with everything we should be saying in this meeting.
We all have a new level of respect for each other, so it makes it easier for us to have hard conversations and deal with stuff better as a team.
You can go into a conversation without having to worry about, geez, did I just say something wrong? Or should I have said that?
It's okay to deal with the uncomfortable situations and talks that you may have.
The five behaviors of a cohesive team helped us move really to the next level of our performance. This investment was well worth it. How do you measure increased quality? How do you measure the fact that something wasn't overlooked? Those kinds of things you can't measure. They're the absence of negative things happening, but they are realized and they make a difference.
In August 2016, Saturday evening, we had a horrific event that took place with a multitude of lightning strikes taking place on the top of a three-story structure. It was an independent living setting. We're fortunate. We didn't lose anybody. We can replace a building. We didn't lose a life. If we didn't have that talent in place and if we didn't have that cohesiveness, we wouldn't have been able to provide that care and support as we did.
These are next level things that don't happen with the unit manager team not working together, not communicating effectively. That moment, I'm going to tear up a little bit, was worth everything.
So, how can everything DISC improve patient care? In healthcare, communication is essential to patient safety, teamwork, and trust. And we know that every interaction, whether it is a nurse handoff report or a discussion in an interdisciplinary meeting, is going to directly affect patient outcomes. And even unintentional miscommunication can result in delays, medical errors, and patient dissatisfaction. So everything DISC empowers our nurses and doctors to understand their own communication style by adapting to others, which includes the patient. So by recognizing different approaches, staff can communicate more effectively, both with colleagues and patients, to reduce misunderstandings and improve your care plan. So adapting to that patient's unique communication style can significantly build trust and ensure clearer understandings. And then DISC also fosters the teamwork between our doctors, nurses, healthcare professionals to make a cohesive environment, which is ultimately going to lead to a patient's trust in our facilities. Um, so there are many aspects of patient care that are positively impacted, but the two that I want to highlight today are psychological safety and enhancing staff morale. And so when it comes to psychological safety, like I was saying earlier, patients benefit when the staff feels safe. When they see the team operating at the highest level, eliminating these constant misunderstandings, the patients feel safer themselves. And when they feel heard and really understood by their caregivers, they're more likely to follow through on those care plans that we send them home with, which is going to lead to higher satisfaction levels, especially with your HCAP scores. And then staff morale in high stress environments like a hospital, this takes a toll on our morale more than any other industry, and it's going to lead to burnout and disengagement quickly. So when staff members feel like they can communicate effectively and there's harmony within the facility, they're going to experience greater job satisfaction and not just stay at your facility, but stay in the field of nursing itself. And so ultimately, when we're connected, communicative staff is going to lead to just a more efficient and a more compassionate healthcare environment. And to tell a little bit of a personal experience here is I'm the patient advocate for my entire family. I'm the only one that has a foot into the medical field. And so I've been there a lot through open heart surgeries, broken legs, you name it, and been an advocate at multiple large hospitals. And unfortunately, last year I had a big health scare myself. And I was med flighted to a trauma one facility who, half the staff was probably traveler nurses, had about 10 doctors, and the cohesiveness, um, the the communication style of every single staff member, whether it was billing, MRI techs, the janitor, even case manager, it was very cohesive. You could tell they had a lot of effort around something like this, and it really made a huge difference in my recovery and in comparison to a lot of other large hospitals that I've experienced with. So that's my little firsthand tribute there. But we know that high turnover in hospitals is leading to our staffing shortages, making it harder to maintain these adequate nurse to patient ratios. And it not only increases the stress and burnout among your staff, but you're forced to rely on expensive temporary labor. And at the same time, demand for healthcare is rising due to our aging population, making it even more critical to retain nurses who can provide that consistent, high quality care that really knows your hospital inside and out already. The financial impact of turnover is significant. I'm sure you all are aware, but we've reached $56,000 on average for nurse turnover. And this can add up very quickly when multiple nurses leave at once, draining your resources and increasing your operational costs. And beyond that constant turnover, your team dynamics will be disrupted, reducing your quality of patient care. And again, like I said earlier, patients notice when your care feels rushed or inconsistent or your nurses don't feel very valued. It leads to lower satisfaction scores and potentially safety concerns and a negative word of mouth. And we know a hospital's reputation is directly tied to the ability to provide excellent, reliable care. And this high turnover can damage your reputation, making it hard not only to attract skilled staff, but patients again. So ultimately, we believe investing in nurse retention through leadership development, communication training, workplace culture improvements is a far more cost effective option than continuously replacing your staff. And again, a stable, engaged nursing team leads to better patient outcomes, a healthy work environment, and long term financial stability. And nurse turnover is more than just filling vacant positions, it's a costly cycle. The NSI 2024 survey revealed that the average annual cost of turnover for bedside RNs per hospital is about $3.9 million to almost $6 million now. So this leads to diverting funds in essential patient care that can really put your hospital behind. But the impact also goes beyond the dollars. And when nurses feel disengaged or unheard, it leads to breakdown in teamwork, decreased morale, and patient safety goes way down. And in fact, improving communication and encouraging staff involvement could help prevent up to 40,000 patient deaths annually in the US, according to script.org. It was a pretty incredible statistic we found. So the millennial generation has become the largest group of nurses in the workforce. And as nursing leaders start to recognize this generation's tendency to switch employers frequently, it's crucial that your organization identifies and implements a strategy to reduce that barrier and retain your millennials. And in an article written by Aspen University on how to lead millennial nurses, it emphasizes that millennials seek access to their managers. Nurse leaders must be accessible. Millennial nurses want the opportunity to connect with executive level leaders and prefer managers who act as coaches or mentors, not as bosses. Taking the time to offer guidance to extend yourself as a mentor shows you cares, fosters engagement, and provides insight into what's happening to your team. So, we believe that by becoming more self aware, understanding these diverse communication styles, we can help your leaders create that supportive environment that millennials seek in their workplace relationships. And focusing on this deeper connection helps foster resilience during challenging times, and boosting your employee satisfaction and empowering your next generation of leaders. With the Everything Disc toolkit at your disposal, you can approach these relationships and end these conversations in a way that's personalized and not this one size fits all kind of blanketed culture. And when people feel genuinely valued and seen as an individual, it's going to be a lot harder for another hospital to throw in $3 or $4 more an hour and recruit them away from you. So, again, offering these professional growth opportunities, hospitals not only help their staff refine their communication and leadership skills, but also fosters a sense of ownership and pride in their work. So, one of the most effective yet underutilized strategies for retaining nurses is the stay interview. So, unlike exit interviews, which only tell us why someone's leaving, stay interviews help us understand what keeps our nurses engaged and what might push them away before they decide to leave. I really encourage these starting out, 3, 4 months into a new nurse hire because we're seeing how hard it is to keep these first year nurses engaged, especially in rural healthcare. And so these conversations are simple but powerful. And you want your nurse leader to sit down with each individual and ask questions like, what do you enjoy most about working here? What challenges are making your job harder? What would entice you away? And what could we do to make your experience better? And having these conversations proactively, you can address issues before they lead to the burnout and turnover that you're never going to reel them back in when they get that far down. So again, sometimes it's about small changes, better scheduling flexibility, improved team communication, or just more opportunities for growth and leadership for some of the younger staff potentially. Um, and it also makes nurses feel valued and heard, which is critical, especially for millennial and Gen Z nurses who rely on this regular feedback and development opportunities. And again, it ties in directly to what we're talking about here today. And the tools like Everything Disc and the emotional intelligence training can really enhance these leadership skills for your unit directors or whoever it may be, and make these conversations productive so that hospital leaders can listen, adapt quickly, and act on what their nurses truly need. So in healthcare, patient satisfaction isn't just about medical treatment. It's about the entire patient experience. And that's exactly what HCAP scores measure, as I'm sure most of you on this webinar know. But one of the biggest factors influencing these scores is communication. How well our nurses and doctors connect with the patient, how effective hospital teams collaborate, and how quickly your staff responds to patient needs. This is where Everything Dis makes a really big impact. And by helping healthcare professionals, again, understand their own style to learn to quickly adapt to the patient style, is going to foster reduce misunderstandings and create a more patient centered environment. And again, a more engaged, cohesive team leads to the higher satisfaction scores and really can help attract patient over other nearby facilities. So investing in a program, a learning and development program like this, it's not just a tool for professional growth, but it's a direct pathway to better patient experiences and just a healthier work environment for all. So the key takeaway for today is that when we truly take time to connect with and understand one another, we lay the groundwork for achieving extraordinary outcomes, both in the workplace and beyond. The foundation of a strong, effective team is built on trust, open communication, and empathy. And these elements allow individuals to feel heard, valued, and supportive. In healthcare, connection translates directly into better collaboration and improved patient care and a positive work environment where nurses and healthcare workers are empowered to do their best work. In the end, it's the power of human connection that drives both individual success and collective achievement in healthcare, ultimately making a profound impact on the lives that we serve. And I won't take the time to read these reviews aloud, but I wanted to put them in the presentation just so you guys know how incredibly important feedback is to me and how we are constantly striving to improve, ensuring that we can best serve others in the most effective way possible. And after the presentation, Rachel's more than welcome to send this out if you'd like to dive into those a little bit more. So commit to being a leader who not only drives results, but also inspires growth, trust, and collaboration. By first understanding those you lead, you build a stronger connection to create a culture where everyone thrives. Leadership isn't just about direction, it's about empowering others to reach their full potential. So I did going to wrap up a little bit early today, but I wanted to thank you for your attention. I really appreciate the opportunity to share that TRS Healthcare is really focused on being a well-rounded partner for all of our rural hospitals and bringing these insights to you.